So most people want a fast diagnosis, a clear cure, they want to spend time with the provider, they want to be heard. Unfortunately, the emergency department doesn't really provide any of that, right? It provides maybe 5 minutes of triage, quick consult with a provider, a long time waiting for maybe an unnecessary test, maybe a necessary test, and then usually at the end, just to be told this is not an emergent condition. Please follow up with your primary care physician. So that can be extremely frustrating for patients, and it's also extremely frustrating for providers because the goals of the emergency department and the goals of the patient are often at odds. So the other thing we hear a lot is patients come into the emergency department and they really don't understand the goal of the emergency department. So they might be coming in for something that's not necessarily emergent, but it is impactful and emergent to them, and they may have nowhere else to go. So considering that, when we think about how do physical therapists in the emergency department increase patient satisfaction, there's lots of different ways. So I have a case example for you. I had a patient who was in a rear-ending motor vehicle collision, young man. He came in on a cervical collar. The physicians had already triaged him, removed the cervical collar appropriately, didn't order any imaging. It really wasn't warranted or indicated, and said, hey, you can discharge and follow up with your regular doctor. Everything looks okay. And family was just livid. It felt like this was an unsafe discharge. He didn't really get a real evaluation. And so we were asked to consult as a second opinion, which I think it would have been probably even more appropriate if we had seen that patient initially, because we really would be the right providers for this type of diagnosis. So we're able to really confirm that discharging the cervical collar was appropriate. We also agreed there wasn't any need for unnecessary imaging. We did a really thorough upper quarter screen, functional screen, talked to the patient about their goals, what their limitations might be, the symptoms that they were having, gave them some comprehensive education and a resource guide, as well as access to follow-up care. So spending that time doing that thorough evaluation really made the family and the patient feel more at ease. It also prepared the patient to know what to expect and how to follow up on their own. So I think that was a really good example of one way we can improve patient satisfaction. Also, if you come into the emergency department and we can take away your pain, huge for patient satisfaction. If you come in after a fall and it's not safe for you to go home and family's been really worried about you and you've been worried about yourself, and we can get you to rehab placement, which might be appropriate, that also increases patient satisfaction. If you come in feeling incapacitated by dizziness and we can do maneuvers and take that away, of course you're going to feel satisfied. Additionally, PTs have been shown to increase provider satisfaction as well. So I know that wasn't on the initial list, but all of the research bears out that physical therapists are very highly valued by their peers.